aka Trikes a lot. Decided to make a video this morning after reviewing some of my previous videos. Uh, I did notice that being the observer and watching the person on screen, which would be me, uh, noticed that it seemed to be very fidgety, nervous, almost even uneasy in front of the camera. But basically, uh, I just thought I'd explain a little bit as to that is coming from some medical conditions, basically. So after working with my primary care physician, um, going in for checkups, physicals, uh, maybe complaining about some soreness, some stiffness, and after going through X-rays, MRIs, CAT scans, all of those tests and things, my primary care physician diagnosed me with a degenerative disc disease, two, spondylolisthesis, which is kind of like a back sprain, if you want to think of it that way, and spinal stenosis. So I sat down with my physician and I asked, like, so any idea what would cause that or lead up to those kinds of conditions? And basically, it could be three different things that could cause it, potentially cause that. One is age. As we age, and our body's been through quite a bit over the years, things change. Uh, Maybe there's been some injuries, some damage that can affect certain areas. Uh, Activities, injuries. So I played sports in school, baseball, basketball, football. I've certainly had my share of injuries, so to speak. And the other thing is hereditary or family history, in which my case, from my family, uh, there's a very, very strong case and evidence for arthritis, osteoarthritis, rheumatoid arthritis. So my doctor said it could be any one of those. In fact, in some cases, it could be something that you're born with. Um, Maybe where nerves pass through the spinal column, the openings, whatever, maybe they were a little smaller than normal, that kind of thing. Anyway, so I then asked my doctor, I said, well, you know, what can I do to maybe slow down the process? When I wake up in the morning, it's it's tough to really get going. I mean, when I go to bed at night, I feel pretty good. When I get up in the morning, of course, that makes sense because when you get up, you've now been laying, resting, fairly still for, I don't know, 6, 7, 8 hours. So with no movement on the areas that are affected, the joints, those type of things, you probably can appreciate that there would be some stiffness and some soreness, because once I'm up and about and get going, after about an hour or so, yeah, you can start feeling a little bit looser and a little more limber, because now you have been doing some motion and some movement. So all of this is leading to uh, riding my trike. It could be, any person riding a trike, a bike, it doesn't matter. When I talked to my physician, he said, you know, anything you can do to, if there's an issue with uh, narrowing of openings where nerves pass through, uh, any joints that have been affected. Maybe there's some arthritis in the joints, those kinds of things. Anything you can do to strengthen, and improve the conditioning of the soft tissue, connective tissue, muscles, ligaments, tendons. Anything you can do to strengthen that can help and certainly reduce pressures and stresses on the joints themselves. So I thought, okay, I mean, I know what areas on me, my part of my bodies are affected. So it was for me, it was simple. It was uh, really focusing on the core. So when I say core, I mean, the abdomen, the lower back, the buttocks, that area. Whatever I could do to strengthen those areas, and then trying to figure out, well, what are the best activities or exercises to strengthen those areas. And uh, even something as simple as walking. Now, jogging, I mean, I think jogging could be fine. I think that puts a lot more impact and stress on the joints when you're running. A simple brisk walk could be just as good. Uh, Riding a bike, swimming, those are very good activities and exercises to do. And those have very low or little impact on the joints. So, for example, for cycling, uh, you're strengthening the area, soft tissue, connective tissue around the hips, knees, ankles, basically the lower body. And there isn't much stress or loading on the joints. Basically, it's just that motion, the moving of the joint, not actual pounding or forces on the joint itself. So I have been riding bikes, trikes, trikes just recently, but I've always ridden a standard diamond frame bike since I was a kid, basically. And I always felt it made me feel good after riding, getting out and doing a little bit of work and exercise. So another condition that I was diagnosed with, and I mean, this is, something that males, especially when you hit like around age 50, can relate to. That could be a condition called BPH, enlarged prostate. So when I was diagnosed with that condition, I thought, well, I still love riding a bike, so what can I do to continue riding? Well, I basically tried every seat I could think of, every seat manufactured or known to mankind. And it didn't matter if it was thicker, heavy padded, thinner, long and narrow. I tried them all, and because of the uh, situation in which you are sitting on a saddle and all your weight going down on the saddle in the prostate area, I could never find a seat that helped me. And I mean, I didn't have to be on my bike very long, just short little rides, whatever. And there was so much pressure on my prostate, I decided, okay, well, this isn't going to work. So, what do I do to continue to ride or any kind of a bike, whatever? And I did a bunch of research and came across the recumbent trike and went to a store, talked to some people there, tried one out, rode one, and it was amazing about how much more comfortable it was for me. No issues with my prostate, no pressure on the prostate. Uh, Basically, sitting back in a reclined position, still able to get a good exercise and workout for the lower body, for the core and the legs. So that's when I got my trach. So another condition that I was diagnosed with. So between those issues and, of course, talking about my other conditions that I have are also related to arthritis, basically. And 2 years ago, I was almost down and out, very, very much, or a lot of pain in my hip, my left hip. And I didn't remember doing anything that would have uh, caused the, the pain, like a fall or any traumatic impact, that kind of a thing. So I went to one of the top orthopedic surgeons in our area here, talked to him, did some x-rays, checked everything out. And normally you have that fluid sac or joint around the hip where the ball and socket is. Well, when he took the x-ray and showed me the x-ray, it's like the arthritis went wild and completely, that fluid joint around the ball and socket of the hip was gone. So I basically ended up with bone on bone condition. So then, of course, I had a total hip replacement on my left side. That was 2 years ago. And again, talking to my orthopedic surgeon, I asked him, first of all, how long do these artificial joints last, longevity wise? How many years are we talking about? And the newer ones today compared to the older ones, when they did the replacements years ago, the life expectancy of the joint was far less, maybe 10 years. Now, the joint that I have in my hip is, my surgeon said you could expect maybe even 20, 25 years out of that joint. So then I said, okay, well, is there anything I can do to help that along and maybe even, make it last longer? And again, it was the theory again of strengthening the soft tissue, muscles, the connective tissues, ligaments, and tendons, strengthening that area around the hip, and that would help in the sense that even from cycling or whatever I'm doing, walking or whatever, any of those activities would again reduce stress and loading on the joint, and then like the soft tissue, connective tissues taking over and helping that. So after hearing all these things and knowing the conditions that I basically have, I thought I'm going to ride my, I love riding my bike anyway, but I try to put on maybe 10 to 20 miles daily. I try to do that most every day. And then once in a while, go on a little longer bike ride, maybe 30, 35 miles. There's a lot of nice areas where I live to take a day trip and see the scenery and everything else. It's really beautiful here. But I know that once I finish a ride and I get up and off the trike, I feel fairly limber, uh, feel very flexible. Uh, I don't really have any discomfort, pain, or sensitivity. So if I go on a ride in the morning or even in the afternoon, the rest of the day, I really feel good, even up until the time of going to bed. But boy, after resting and sleeping all night for 6, 7, 8 hours, getting up in the morning, that first hour or so is pretty tough. I mean, I just have to say to myself, okay, just move around, get going, and you'll be limbering up here pretty quick. So when I mentioned spinal stenosis, the diagnosis for me was down in the lower part of the back again. So at the sacrum area, basically, there's an opening where the large nerve comes from the spinal cord, goes down the leg, which is the sciatic nerve. So the X-ray taken there showed a quite a bit of reduction in that opening where it was restricted. And again, I mean, you can tell pretty much by looking at an X-ray uh, if arthritis is present, because arthritis displays as a whitish area around the uh, structural part, the joints, the bones, and the area where the sciatic nerve passes through is fairly restricted. So that was another issue where anything you can do to improve and strengthen the soft tissue, connective tissue around that area can certainly help alleviate or help the pain in that or discomfort in that area. Every once in a while, I may have a little bit of discomfort sometimes if I move in one direction too quickly or make a strange or abrupt motion. I might notice that, but after a little bit, it tends to generally go away. So, I mean, when I think of the conditions I have, if I wouldn't focus on the activities and the exercising and the strengthening of my core, if I, over the period of the nighttime when I'm sleeping, laying still, not moving, and I get up and I'm really, really achy and sore and stiff, I think to myself, well, if I didn't ride my trike the way I do, uh, and very little form of exercising beyond that, how would I feel going through the entire day? I mean, it's to me, it's shown that the increased mobility and movement certainly helps me be more limber and a little more flexible, uh, can do more things throughout the day. If I didn't have the activity of biking, triking, riding around, uh, I may be feeling the discomfort and the tightness and not being limber throughout the entire day. So it's been a wake up call for me, and that's why I continue to do it to reap the benefits of strengthening the core, the area, the soft tissue, and the muscle to uh, help eliminate, not eliminate, but uh, contend with and put up with the issues that I had really going on. So, that being said, I would like to recognize and thank a gentleman. His name is David Goldman. And David Goldman is also known as David Rides a Trike. So, if you've seen any of David's videos, and I think to myself, I have these issues and problems from a health standpoint or medical issues and things. When you watch or listen to David on his videos, I mean, the problems I have pale in comparison. I mean, David uh, is a true inspiration and like a diamond in the rough, being able to uh, handle all of the adversity and the medical situations he's been dealt with over the years. Uh, I have a lot of admiration and uh, am very grateful for the videos and conversations, dialogue that David has put out. I mean, I have certainly provided my own motivation to uh, try to uh, combat the issues I have. But watching David's videos and listening to David speak has helped me immensely in staying on that path. So, again, thanks, David. And I hope you are doing well and keep on triking. So, I plan on having a example of a document that I can show as to everything I had discussed and mentioned, the conditions that I have. So I'm going to uh, set that up and get that going, and maybe you'll be able to understand and see better what I was referring to with the medical conditions I'm facing. Thank you. So, in the case of my degenerative disc disease, it's mainly noticeable up in the cervical area and the lumbar area. The spondylolisthesis has been determined to be a level 1.5, a low grade level. And that means that the shift between S1 and L5 is about 25%. So, talking to my physician, in order to maintain that level and to prevent it from getting progressively worse, this is where the strengthening of the core, abdomen, uh, the buttocks, and the lower back area can really help that situation. And the spinal stenosis is down in the sacral area, uh, in that part of the bottom part of the spine. There is an opening that is, as I mentioned, restricted by the arthritis where the sciatic nerve passes through. And again, doing any kind of strengthening, conditioning of the soft tissue can really help with that issue as well. So again, thank you for your attention, and I hope this was beneficial and can help anyone that might be experiencing the same things. Thank you.